Hello, my name is Michelle and I'm a student physical therapist, and today I'll be conducting an Astrand Cycle test with my colleague Alyssa here. This test is going to help determine VO2 max based on some vitals that I gathered during this test. Prior to warming up, I measured her resting vitals. Her heart rate was at 64 beats per minute and her blood pressure was 102/68. The bike seat was set at proper height at the level of her greater trochanter, allowing for about 25 degrees of knee flexion. She has been warming up for about 2 to 3 minutes now at 25 watts and at about 50 revolutions per minute, which is standard for a cycle test. I will now take her heart rate and blood pressure to make sure we have a normal response to this increase in activity. If I can just grab your hand for me, thank you. And so what I did is I just used this clock on the bike and took her heart rate for 30 seconds and multiplied it by 2, and so we got 84 for that first one. And now I will take your blood pressure. You can go ahead and rest your hand on my shoulder. I'm going to stabilize your elbow. And we're going to take your blood pressure. Good. So your blood pressure at warm-up is at 116/70. Okay, I've taken her vitals, and she has a normal response to this dose of exercise, this increase. Her heart rate was at 84 beats per minute, and her blood pressure 116/70. Alyssa is a young, healthy female who exercises 5 days a week. She has no family history of cardiovascular disease and does not present any signs or symptoms of CV, metabolic, or renal disease. As a result, she has a low CV risk stratification according to ACSM. Medical clearance, therefore, is not necessary, and it is safe to continue with the test. And because Alyssa is fit and active, I will increase the workload to 100 watts and for the submax exercise test while she maintains a rate of 50 RPM. I'm going to go ahead and start my stopwatch, and we're going to begin the test. I will continue to monitor her changes in blood pressure and heart rate for the duration of 6 minutes as she responds to exercise. Make sure you're maintaining 50 RPM. We're almost at the 2-minute mark. Okay, so it's been about 2 minutes. I'm going to go ahead and take your heart rate, but actually before we do that, I have the board scale right here. What is your rate of perceived exertion? 11, okay.
Oh, actually, hang on. Yeah, 7.
7? Oh, okay. Just kidding. So, 7. You sure don't you want to do 11 maybe?
Yeah, maybe 11.
Okay, 11. 11 is the best one. Okay, so let me go ahead and take your heart rate again. Okay. At minute 2, your heart rate was 122 beats per minute. Now let me go ahead and take the blood pressure again. Okay, I'm going to have you do the same thing. Put your hand on my shoulder. I'm going to stabilize your elbow. Here we go. Very good. And that was 128 over 72. So both of her vitals were what we would expect. Her systolic pressure raised slightly and her diastolic blood pressure just didn't really increase at all, kind of just fluctuated slightly. So as a result, it is safe to continue with this test. We have no reason to stop. And in a couple minutes, I'll take your vitals again, but this time we'll take heart rate twice to make sure that you are at steady state. All right, it's been 5 minutes. What is your rate of perceived exertion based on this scale?
14.
14? Okay. All right, and I'm going to go ahead and take your heart rate. At minute 5, her heart rate was at 136. Now I'm going to take your blood pressure. Blood pressure 138 over 72, and then one more time for heart rate. This time I'm going to do 15 seconds. Okay. Minute 6, heart rate was 140. So it's been 6 minutes, and Alyssa has reached steady state. I will now bump her down to begin her cool down. She achieved steady state by being within the 60 to 85% heart rate range of her age-predicted heart rate max, which I calculated to be between 114 and 162. So now we're going to have you cool down for about 2 minutes, and good job.